Efeson. Welcome to the Everyday Leader. It's so good to have you here. How you been?
I'm good. Thank you, Dr. Ananya. Nice of you inviting me.
So good to see you, man.
Yeah.
So I know you. We've been friends. We've worked together. But for the audience who don't know you, let's start with your journey. Who is Dr. Efeson? How did you get here? You're wearing your scrubs right now.
Yes, I love it.
How did we end up with the scrubs? Tell me.
So it is a long story. I'm from I say like third tier of third world. Even in the third world there are classes. So I was born in a very rural village and grew up there. Had my school began there. So it is a long story. I had my first shoe when I was grade 10. My father bought it as a reward when I scored good grade in my 10th grade exam. And the first time I started reading using electricity was in when I was ninth grade. Now you can imagine how tough it was.
Yeah, where exactly were you born?
That's the southern Ethiopia, Walaita region, but it is a little bit out of the smallest town, even in that area. It was some
Gotcha.
kilometer away from Boditi. If somebody ever heard about that, you can enjoy. Then, when I was 7 and 8, I had to go back and forth more than an hour each time for my school. So it started like that. Then, praise God, I had good grade in entrance exam. So I didn't know much about the medicine doctor, but just because I had good grade and I thought I have to be in a best department because I was good student. I chose medicine. In fact, it was not kind of stream that I would have loved because I used to like mathematics, chemistry, physics. I don't like reading for long, but you don't know what you are doing when you are doing, but you understand it after some time. So I chose medicine, and the first 3 years were not good because, as I told you, I don't like reading something which you nothing to understand. I like reading until I understand the subject. After that, you have to do it with it. Reading it again and again to memorize was the difficult part. So the first 3 years were not good, but I enjoyed clinical years and it was getting better and better. I enjoyed my internship, and during my internship, surgery was the best uh, thing I loved. So I decided even before I left the school that I would be a surgeon. And then I went to very rural hospital. It's far from Addis, 30 kilometers away from Arbaminch, a place called Chencha Hospital. There was no surgeon, no gynecologist, and there are one GP and one health officer who were doing cesarean sections uh, when there is indication. And one day, both of them were not around, and I was the only doctor in the compound. And a woman came with cord prolapse in labor, and they were shouting at me, asking me, "Please help, doctor," this and that, but I couldn't do anything. So I was about to escape from the compound, but nurses were also coming to my house, so I had to attend the delivery. The knowledge we had, me just position, put on oxygen, some resuscitation thing. Praise God, it went well. That day, I decided I have to change my practice. So I asked them to send for short-term training, at least to do that kind of things. So I had my training in emergency obstetrics and served as emergency obstetrician for 1 year, and then I decided to uh, pursue my career as a surgeon, and that's how it started.
What an amazing story. I don't. I don't even know which part is more important than the other. It's just jaw dropping from
True.
the get go. Um, and this is what I love. A lot of people, when they see us as surgeons and physicians, they think we come from this privileged place, right? But we all came from our own struggles, you know.
True.
Um, the price you have paid to be where you are, all those things you talked about, and you summarized it and you just went through it real quick. Like if we go into the details, there are so many details that
True.
really shaped who you are.
Absolutely.
Yeah, and I love that. And I love it because someone who, when you see a patient, you understand them because you have shared that life. You were
Mm.
part of that life. So
Yes.
you understand them and you care for them in a very different way than somebody who, let's say, who was raised in the city, who doesn't understand that side of, the country and the culture and the context. So it's really beautiful. God bless you
Thank you.
for
Amen.
persisting
Yes.
with this. Because I know you help a lot of people. We work together,
Yeah.
especially Social Christian Hospital, the program that runs there, and even at MCM. That you're now in MCM. You're
Yes.
working at.
Yes.
Yeah. Okay. So tell me, you didn't tell me about how you got into the PAX program. I love that program. I have reasons why I love that program, but I want to hear from you. Why is it such a great program? Tell me more about that.
Yes. If you want to see, I proudly wear my Pax cape every time when I do surgery, because as you said, I have a lot uh, with this organization. So when I was doing my general practitioner years, I had a friend who was a Pax resident, Dr. Sen, you may know. So I used to meet him whenever I come to Sodo. So he used to tell me what they are doing. It was kind of, the curriculum was developed in a way to address the real scenario in Africa. It's based in USA, but the curriculum was structured and developed by missionary surgeons who have served in Africa for like 30 plus years, 20 plus years. So someone who knows everything about the rural area and how difficult to deliver surgical service. So I like the way they run the program. So when they rotate to gyne and obstetrics department, they do as if they are going to be gynecologist. And when they rotate to the orthopedics, as you may have seen, we do that rotation as if we are going to be an orthopedic surgeon. And the same is true in other departments. And when there is a shortage of patients, or when the attendants are not enough for the number of residents, right away they may even send you outside the country. And I went to Malawi for 3 months for that reason. So when I saw the way they were doing, I decided this is the place where I should go, because that time the only thing in my mind was to finish the training and go back to where I came from, the rural hospital. And my expectation was I might be the only surgeon serving in all these areas. So I thought it would be the best program to go in and learn in every area from the experts and serve the people most in need adequately. I Because as just I mentioned you, I knew how it feels when you are there as a doctor and you don't have the skill to give the service needed in the right moment. So that's the reason why I chose to be a PAX resident, and I applied for PAX program, and they accepted, and I started my residency program in 2012 August, and it went very good. So as you can imagine, there are lots of ups and downs, but ultimately, I believe I became the surgeon I wanted to be when I joined PAX program.
That is beautiful. That's so good. Yeah, for whatever reason, what I remember was because during our training, we used to come to Soto Christian Hospital, and you guys were there. And for whatever reason, everybody in the PAX program were such nice people. That's what I.
Thank you. That's generous.
Yeah, even the surgeons, the attendings, they were just fantastic people. So kind to patients, so kind towards other colleagues. Even like not just surgeon to surgeon or trainee to trainee, but also to the ward nurses, to the janitors, every single person that was involved. It was such a beautiful environment, and I've always wondered how that could be created, because you don't get that from the curriculum.
Yes,
There is
yes,
something
true.
else that happens. So,
Yeah.
do you know the secret? If I mean, you were in it, so what's the secret?
Yeah, yeah. I think it's a little bit different than other programs in a teaching hospital. So one thing, you know that you are resident, but in hospital you are treated like staff. That's I think the difference, because the nurses, everyone respects you as a doctor, and still you get your training, and you also communicate with them that spirit. So it's kind of a family, small group. You may remember that we might be like 7, 5, or something like that, and the attendings are 3, 4. So the ratio is like 2 to 1 or something like that. So it's very small family working every day, every time together. We have time of sharing life experience and time of praying together. And one of the thing is, apart from the surgical skill and scientific training, they also train us a professional to be a servant. That's a Christ-centered kind of service. So there is a process to make you at the end of your training to feel like you are serving others. It's not just becoming a surgeon. Surgeons some component of arrogance there, and they say that's also important, and I partly agree. But more than that, they pass the message that you are here to serve, not to be served. And to be that kind of person, the character needed should be like, treating each other. It starts with among the group, treating each other like a friend, like a family, and patients all the same. So it's, I think, from what they have passed through the experience, the best person who can serve patients as needed is someone who has a servanthood mind. So I think that has very important part in the training, because as a surgeon, the patients are always there looking for help, and you should be a servant kind of person.
100% agreed. And when you see our patients, they usually come from, I don't want to say illiterate, but like less educated background.
Yes.
So they look to you not just as a doctor, but like a father, like an elder who's gonna make a decision for
Yes.
them on their behalf. So it's very important to have that humility, and to to just take off all that, whatever pedestal you put yourself in, and just be human, and then still serve them with the god-given skills, and the skills you're trained with. So that's beautiful. I love that, and I think we should really adopt that
Yes.
environment in every training.
True.
We talked about humility, but it's very hard for you to be humble, because there's no stopping you, man. You're just going up and up and up and up, just climbing the ladder. So I know you're a member of American College of Surgeons,
Yes.
and I have a lot of friends who are surgeons who are interested in becoming a member. So just walk us through quickly the process, why you did it, what's the benefit. Just, yeah.
Yeah, I knew about that thing because I saw some doctors who became fellow of American College of Surgeons. But personally, initially, I didn't think about it. But the friend of mine now in US, he is a public health expert. Usually, we communicate on different things. Later, we might go more about him, what we are doing. But then he sent me the link and said, "Why don't you try this? This looks very nice." Then I looked at it. So the then application is just simple. There is nothing. Even I have shared more than 10 surgeons this year to go through it, and everything is at hand. and you need only 3, 4 surgeons who are American fellow of American College of Surgeons to recommend you, and it just it's easy to go through. And benefit, you have a lot of connections. Even after I became a fellow of American College of Surgeons, I get emails every single day from different groups, different communities, for like articles, recent ones, training opportunities, grants available, publications. Is overwhelming, So I believe, we should not be like a local people or local something. Now, the world is a just village, and the medicine is international, and the licensing process might be different here and there, but as a surgeon, you are at that level if you go wherever. So it's good to have that kind of community, to be part of that kind of community and share what you do together. And after being the fellow of American College of Surgeons, I have met a lot of people, and we had even some discussions to create bigger platforms to discuss about things from here and there. And so I encourage people to consider it and apply for it. It's easy, and the benefits are a lot. Even I'm not that kind of person who's looking after it asks consistency, diligence to look the opportunities. I believe there are many that I didn't even see. So I really encourage them to look for it, consider to apply, and be part of the bigger community.
Yeah. They say your network is your net worth, right? So it's
Sure.
really about networking, whether you want to advance academically, whether you want to advance, professionally. You just networking is the key.
Sure.
So that's very good. And like you said, the world is becoming like like a village. It's one place. Everybody's
Yes,
coming together. Globalization has been in effect for a while, so we need, it's not something we should run away from, it's something to embrace. So
exactly.
thank you for sharing that. So you've worked in the Ethiopian surgical system. You're based in Ethiopia, so you've worked in the Ethiopian surgical system, and you've been exposed to a different system in Malawi as well. um, let's focus on the Ethiopian system. Where do you think lies the strength, and where do you see the system failing? Not just the patient, but also the surgeon as well.
Yes, I think it's difficult to point out single strengths or the area where we are failing. But the good thing in Ethiopia is we have now a lot of schools, surgery residency programs. As you know, there are big university-based residency programs, and recently we had a lot of like general hospitals, comprehensive specialized hospitals in big regional cities. So initially, when it was being introduced, I was skeptical. In a place where there is maybe only two surgeons, no a lot of no enough subspecialties. They were starting surgery residency programs. But when I see now, I think it's good to produce. The quality could be at any level, but at least having surgeon trained for adequate period of years, with having some exposure in experienced centers. I think that can be taken as a strength, because as time goes, there are when you have a lot of surgeons getting graduated, the individual strengths of that surgeon, they may look for themselves to improve their uh, skills, their connections here and there. Now you see people going to India, anywhere in the world, and getting further training, be it short term or long term. So it became daily routine that big surgeries, the first of its kind, complicated ones in every specialty, are happening, even in regional uh, hospitals. When I was a resident, I remember in southern part of Ethiopia, I think there were like only two or three surgeons. One in Awasa, one in Sodo, one maybe in Arbamij. You can imagine. I remember there was a time when I was a general practitioner in Saula Hospital, Gofa. We had a casualty. 80 plus people were involved in car accident. We didn't have surgeon. We cannot refer all these people there. So what we came up was starting triaging, and I was a medical director. I called to a surgeon who was in Arbamij, Dr. Ndale, now breast and endocrine surgeon, to come to our hospital rather than referring patients to other hospitals. So we didn't have X-ray, what we call this, the old something cassette, something. They brought it with them from Arbamij to Saula Gofa, and he did overnight like 4 or 5 patients, and next day live. So that we did that because there was no single surgeon in zonal area. So now, if you ask me, you cannot find a big hospital with no surgeon unless there is a some specific issue. So definitely we can take producing large number in different hospitals throughout the country, whatever the quality for now is strengths, because the Ministry of Health were using task shifting, like training health officers for some time and letting them to do surgical procedures, helping emergencies. That was also somehow good, but it cannot be a long-term solution. So now producing surgeons, different hospitals, many hospitals where there are capability of any level, can be taken as strengths. That's what I liked about Ethiopia, because I have seen some other countries. Still, there are countries in Africa, in West Africa, in southern part, where no surgeon in a big region, and that's why I think most of Ethiopians, out of this big number producing recently, they are going everywhere in Africa, and they are being welcomed so well and doing very great job. So I think we can count us as uh, strengths.
Yeah, those are good points. I think we've all gone through that phase where we're like, should there be this many training programs? Should there be a training program at that hospital? But then, like you said, down the line, you'll realize, oh, because the goal is first to produce safe surgeons, right?
Yeah,
Safety is the that's the baseline. So if you can have safe surgeons who can safely manage emergency issues,
yes,
especially, and some basic elective things, then that's great. Then you go to excellence, right? So
yeah,
every other system, I think, that has been successful in the rest of the world started there, and then they built their way up.
true.
So,
Exactly.
like you said, now we're coming to centers of excellence, which we're going to touch on our next topic. So, and I think your project, MIS Africa, is level two, right? We've
True.
had safe surgeons. Um, we know patients are well taken care of, whether it's in a regional hospital or even smaller hospitals than that. So now next step two. So you're involved in step two, which makes me
True.
very proud. I'm so proud of you for that. So tell
Thank
us
you.
what MIS Africa stands for, the mission, what are you doing? What's going on?
Yeah, that's a very good point. As we have discussed early, I'm a PAX graduate. So when I was a resident, we used to rotate to MCM, Comprehensive Specialty Hospital now in Addis, and Sodo Christian Hospital in Walaita Sodo. So during my second year, I had an opportunity to to be exposed to laparoscopic surgery. I didn't know about it before except reading on book, which I couldn't imagine if how they are doing that procedure. So during that time, I can say I've assisted 15 to 20 cases, but I liked it from day one. So even some mentors were saying that I think you will be good surgeon regarding laparoscopy. So they used to ask me, "Did you play a lot of games?" I told them what I just shared. It. Forget about computer games. I I had my first issue when I was 10th grade, so it's something. So then we went back to Sodo, and later I didn't have chance to have same exposure again. So you can imagine after second year there was no as such enough exposure for laparoscopic surgery, but I knew that I had very good exposure, still not enough to practice it independently, but I knew that I am about somewhere near to do it myself. So when I finished my residency after 1 year service as junior consultant in Sodo Christian Hospital, I moved to MCM at this, where laparoscopic surgery was being done routinely. Uh, but it was not easy for me to start it independently because the surgeon who does it is very much willing. He always says you can start with diagnostic, you can do it independently. But the problem I think was there was no structured training regarding laparoscopic surgery. And teaching laparoscopic surgery is not like open surgery. In open surgery, as you know, you are an educator too. You can give a case to your resident and you are there at any time. You can take over the case, you can control if something gonna happen or the wrong move is going to be made by resident. But in laparoscopy, when you give it, you just give it. You have only this the camera in your hand, taking that thing and moving this and that. It's not easy. So I found it was difficult to teach. That's why there were few laparoscopic surgeons, but they were doing it by themselves for over a decade. No progress in laparoscopic procedure, be the advancement or then producing another surgeon. So what we came up was myself and my residents. I sit down and we have to do this thing. So how can we do? So we have created these 4 steps, doing our open cholecystectomy in a way we would be doing laparoscopic, achieving critical view of safety, starting always antegrade. We made it a rule. We would never ligate a cystic duct or cystic artery without achieving this critical view of safety. That imagine it's in open cases. So we started to do that to be familiar with anatomy. And then we selected good YouTube freely available channels on laparoscopic surgery. One was SAGES, Society of American Gastroenterology and gastrointestinal surgeons, and the other was from India. Very good teaching videos. I really believe they are very much underutilized. So we used to watch them again and again, and it gives you a privilege of pausing at certain step, going back and seeing things again and again. Then we started this box training, a cartoon box made out of these cartoons, and bringing the actual tower to a room whenever there is empty room, and practicing on some tasks to develop hand-eye coordination and depth perception skills. Then we became like familiar with the skills, the movements, and then I moved to doing simple laparoscopic cholecystectomy independently. And as it always happens, the first case was fantastic. It was like the ideal. Still, that picture is, I think, the best when I see look. So I said, this is the day. It was in March 2020, I think 20. So we did our first laparoscopic cholecystectomy independently. Then we kept on moving forward. Then I wrote a paper how the alternative way of teaching using video, something like that, in our first 39 consecutive basic laparoscopic procedures, and it was presented poster presentation in Namibia in COSEXA meeting in 2022. So after that, I moved to India for fellowship for advanced laparoscopic and colorectal surgery. And during my stay in India, things were not easy as you might expect, be it money or leaving family behind or different culture. And I really appreciate my professor, Dr. Baiju Senadipan. He was amazing teacher. You have like endless tips and tricks regarding laparoscopic surgery from him. So I came up with an idea, no one should suffer like we did. As a surgeon, you can imagine like how difficult it is having that pass that journey to do that simple basic laparoscopic procedure. And I said, no one should pass such a difficult, demanding journey. So we should come up with something to make it easier, at least for surgeons to incorporate this modern technique into their service and education as a modern day educator. So I contacted one of my friends here. The one is Dr. Hilkia. He is now in USA. He has done his public health masters in John Hopkins University. I know people, when I have friends, I know who is good in which part of the thing. So I know he can bring things together. So I contacted him. I'm thinking about having an institution to transfer knowledge and skill on laparoscopy. So, what do you think? And they said there are two ways, the best ways to have good collaboration outside and to come up with something practical. One, we have to establish in a teaching hospital. And the second one, we may think it as a non-profit organization because if you do in like in any hospital, usually you might not find good collaborations if not academic environment. So we thought of both options, and I thought having a small initiative in a big teaching hospital or people are going to give me hard time, and the time it would ask me to convince them even to understand what I'm thinking will be like years. So I said we need something under our control. So then that should be a non-profit organization. So we came up with an idea and everything, naming it with options. We picked MIS Africa. Then we started the process, the legal process. This was happening while I'm still in training in India. So the process was started. Every these legal steps were done, and we got registered under Ethiopian Authority for Civil Society Organization (ACSO). So we became legally registered non-profit organizations, and we started what we are doing now. So the mission is, there are things that we used to hear but which I didn't like somebody is the only one, or the only something, there are only two of these. Yeah, I appreciate whoever who becomes the first to do certain procedure. It takes really hard time, effort, a lot of hard work, but remaining as the only or few for years. I think it was on my somewhere I have that I said being the first one to do certain procedure is amazing, but remaining as the only one for a years more than it takes to teach. Next one is crime. So you can imagine. Somebody might think like that's a foolish way of thinking. We could have been one of few, and you could have access different privilege. But I say to myself before I get graduated, it's a crime. Okay, it's a crime, and it's injustice for people who could be benefited. So what the first training we gave for 16 surgeons at Hayat Hospital was given while I was still there. As soon as we so that this thing is going in the right direction and we are right about thinking it and doing things to kick off, we started contacting people who are willing to advance laparoscopic surgery in Africa. So one of the team were mid-surg support from France. So we contacted them and they said, I think you are doing a good job. And that's what we are also trying to do. There's room to collaborate and we can explore the way forward for our partnership. Then that the same person asked them, why don't you come and we sit down and talk? Then they came, we discussed things. Then we have agreed we can work together. During their next visit, they brought two simulators, and we were ready to give training even before the simulator arrived in Addis. You know, the day they arrived on Sunday, and we have prepared training on Monday and Tuesday. So imagine, no, they arrived on Saturday morning, and the training was given on Saturday afternoon and Sunday the whole day. So it was set up after they came, and training was given. That was the day. It required really adventurous move. We didn't want to give time for doubt and a lot of comments. Whenever there is something looks good, feels right, move. It was happening like that.
That is impressive. I love everything. And this is what I like about you as a person. What I've always liked about you. You are so authentic. You're so real. And I love that you made that statement. It's a crime for you to be the only one.
Yes, should be.
And there's just so much to say about that. But first of all, we have this sum zero attitude where if I'm not the only one benefiting, then it can't happen. Like
True.
you and I cannot benefit together, which is such a wrong perspective about things.
Yeah.
And anybody who has shifted that way of thinking has benefited themselves and others as well,
True.
right? Because if there are a lot of people who do minimally invasive or laparoscopic procedures, then a lot of patients would be aware of the procedures. So
Yeah.
a lot of patients would be wanting to have those procedures done. Versus if
Yes.
you're the only one, there are only as many people as you can reach, right?
Yes.
You cannot
Yes.
reach everywhere. You're just one
Exactly.
person. So that's very important. And always when somebody takes that move of faith, something big always happens. So
Hmm.
I love that you said that, and I think it's great, and that it's focused on training.
Yes.
um, Education and training is just the only way, I would dare to say, the only way to really bring about a profound
Hmm.
and sustainable change.
True.
So I really see that in the work you're doing. And like you said, just don't shut your ears from the
Yes. Yes.
the
As long as
critics.
you win the challenge within, I cannot say, I'm kind of, angel or someone with no. There are fight always, in our mind and our heart. When you want to do something, there's something saying, oh, do you think that so once you win yourself from within and you just stand for the right thing, I think everything else, every shout from outside, every suggestion, comment, it's easy to just say, no, this wrong, this wrong. So that's what we made for ourselves. No matter what, we know, the benefit of laparoscopic surgery is more important for third world country patients than even the West, because of many reasons. The blood loss, the pain, the big incision, duration of hospital stay, whatever. The benefits are more important for our patients than the West. And there is a thinking that it's luxury. Whenever very good thing comes, initially they say it's luxury for you to think about. So I don't agree with that. It's not a luxury. In fact, I came up with a document where I read the top patient. top three patient-friendly innovations since the time medicine has started are: the first, sterilization. Surgeon can do whatever kind of surgery, but if there was no sterilization, every patient will die of sepsis. The second one is anesthesia. You cannot you can do surgery, but anesthesia, there are stories that we heard, causing a head injury, loss of consciousness, and doing surgery. So they say the third is minimal invasive surgery, because you do the same thing with minimal incision without causing unnecessary trauma. That's something you cannot say luxury. If you can do the same job or even better inside without causing a big trauma from east to west incision, that should be something our patients accessing. So that's one of the big pillar. When we train, we are training for the benefit of our patients. The second one is, as we have just discussed, we are producing a lot of surgeons, and we should transfer the skills we have, so that many surgeons incorporate these skills into their practice, so they can develop in their career. They can take this to another level. And as rightly you say, when you transfer whatever you have like there is a necessity for you to push yourself to another level. So they keep on pushing you to do more advanced and to do things better. So if you are the only one, you might just have that whatever you have, and you can remain with it for 20 years. But when you pass everything you have to someone, then there is a demand, there is a push for you to advance. And that's how even I have experienced it in my time here. Even I think it's just a year and 2 3 months. But whenever my colleagues, there are surgeons who work with me, I teach them everything. Whenever they do what I do, then I have to move myself forward. So that's how it should develop as a country too. So that's the only that there are these are the two pillars we have. We have to make this benefit for our patients available. And the only way we can do that, I cannot do that sitting here at MCM private hospital. There are a lot of patients in government places. So we are training surgeons from every corner of the country. We don't care whether they are from government hospital or private hospital. We are not in a competition mood. So anyone can come, get the training. As long as they have set up, we can support, and we can help them to develop their skills. And then patients will be benefited wherever they are. And that's the ultimate goal. And recently, we have started cross specialty training. We are doing very much advanced laparoscopic procedures. Literally, we are doing everything can be done laparoscopically in the Department of Surgery in MCM. But the gynae and obs department, they were not even doing diagnostic procedure. So we came up with an idea: why don't we train them? What you train them is the skill. Well, I'm not going to train about the anatomy of uterus and the hysterectomy, things like that. What I train is just pass the skill. Then they are the one who will move their skill. So recently we have trained two young gynecologists. Now they have started doing it independently, and with my help, we have done two hysterectomies this month, total laparoscopic hysterectomies. Imagine now how they can move faster and bigger, and they can train another. So the same thing is now going to happen in urology department, pediatrics, and we believe that with multiplication only we can catch up the rest of the world. We need revolution in this part of the world, not evolution. That's where MIS Africa comes. That's how we should move forward, and we can come at least closer to where the world is heading now.
100% agree. Um, so, have you yet realized that you are now a leader, or has it hit you? Yes.
I think, there is no need to think differently. I don't believe on positions and bureaucracy and names and this and that. I think what makes you leader is when you do things and you when people follow you and people accept you and people around you are happy, enjoy. So I feel like I'm a leader, and many people used to say that even if when I was not thinking about it. I used to think that I'm a terrible person, communication wise. But people used to say, I think you are a leader and you try to solve difficult things somehow easily and don't take things very seriously as they are. Always come up with some simple solution. So I think so because I could bring my colleagues whom I know well and who can where maybe Dr. Senyi, Dr. Abenezer, Dr. Hilkia, Dr. Nehemia. There are a lot of people working on MIS Africa. No one knows, and I don't pay a single thing to anyone. So everybody is doing it with full joy and happiness. And I think I believe the best thing for leader is trusting people, knowing the potential and empowering them, and just not nagging them at the night. So that's how we are doing. We all like, if you talk to someone, they might talk about MIS Africa more than I do. I tell them, what do whatever you think good for what we are trying to do. So sometimes I hear something, GP, there are even internists who are doing a lot of things. They come up with an idea and I said, go ahead. So I think it's not too much complicated to be a leader and to lead an institution. I agree. I started thinking like that, but I still want to stay the same. Take it easily, move forward, not complicate things. I might be wrong, I might be right, but committed to move as usual.
Yeah. I think I understand why people used to think why you're a leader because I see those qualities in you. Um, Even when we're in different surgical fields, I from the interactions that we've had professionally, I understand why people see what you just said, and I think you're a great leader. So, having talked about that, what's the role of faith, because I know it's important to you and it's
Yes,
important
yes,
to me, and it's something that everybody needs to really think about when it comes to serving others, whether as a physician or any field actually you're in. As long as you're serving other people, um, it is something to really understand and embrace. So, what's the role of faith for you in your career in general, and also as a leader? Is that where you get your blueprint? Just talk to me more about that.
yeah. That's I think the most important uh, point to talk about. So faith, as it's clearly mentioned in the Bible, it's with faith you can see something you don't see with your naked eye, what you don't see in your environment. So I think to have a bigger dream, something that's bigger than within your circle, within your thing, it's faith which always have that kind of thing. So I see it in two ways. One, for whatever I do, I rely on God. So I don't get like overexcited. Even if I do, I usually tell myself to be cautious, and I don't get too much blamed when even things go wrong. So I put my trust in God, and I believe that whatever I'm trying to do, I'm just be, I'm obeying Him. It says obedience to the faith. When faith is there and when you are willing to obey, then things happen. So I don't want to do something more than supposed to be done through me, and I don't want to hold back what could be done. The only thing that would help you to be that kind of person is faith. When you have trust and you have faith in God, you obey to the inner calling. So I don't. I'm not scared when I'm convicted that this is something I should be doing. I think this is something God wants me to do. I don't care about what the outside world says. I know when things are even not looking going good, well, smooth. I know just those things are temporary and bigger is coming. So that's I think you can imagine the journey I had. There are times that I said this is the end of something, but it always, whenever I say that, the next chapter is something bigger I have never imagined. So that's very important for my career and my personal life. The other thing, the second one I want to say is we should understand that life is very short. Many people, I think many people understand this, but after saying that, so you should think how to govern this life. So the main reason we are here in this life is to help others. That's it. So life even doesn't work well, it doesn't flow when you try to make twist it to work for yourself. That's my experience. It flows, it just keeps on going when you let it be for others, for the benefit of others. Like we have just talked, training, teaching. It has, there are things that I might get benefited, fruits, so many things, as you said, connections. But the intention is just to benefit others. I believe that everybody is here to live for others, and others are here to live for that person. So it life doesn't work well, and you cannot live joyfully when you think or you want to work it for yourself. Just let it flow, just let it go. Then you become a joyful person to be around, and many people get benefited and things get multiplied. So that can only come when you have a strong faith. If you are someone who believe I'm sent by God, and whatever I'm doing is my calling, and all the provisions and protections are there when I obey that. So I have no issue, no worries when I am in that state. So when things are not going well, I start to check where I stand, what is the intention, what's happening. So when my intentions are right and I have the conviction, and that's the thing is coming out of my heart, I don't care about what others think. So when people don't give you the value that you deserve, I don't worry about it. I just keep on moving. That's I think what even I want to advise you. You are doing great job. Don't worry about how many people reacted or taking it as you would like, how seriously you are doing these things, and what are the objective goals. People might not understand now. You don't have to give the time for that kind of thing. Just move on. Even like if you invite someone, someone might say, "No, I'm busy," this and that. But someday, people will be lined up to have an opportunity to speak on this podcast. So
I
just keep on
received that.
moving, they will come. So that's uh, is the result of phase. And I'm saying I'm done with it. Everyone is growing. We are growing into the phase. So that's I think what I can say in short.
Yeah. And I received that, man of God. You just spoke over this podcast.
Don't don't send this on. Okay.
But yeah, I think, you know, we just, we're honest, right? we're
Yes, true.
we're real people. Okay, so for whatever reason, faith has been shamed out of the scientific community.
Yes.
It's like, if you're educated and you know this much about science, then you, come on, like faith. It's
Mhm.
like, but at the end of the day, I really do believe, and this is just my personal opinion,
True.
science is just trying to catch up to what the creator has done.
Yes.
Like we're not doing anything new. Let's
Mhm.
just be clear.
True. Yeah, I think partly the problem was when people choose to be man of phase, they used to oppose science. That's, I think, one of the biggest mistakes made there. So whenever somebody, even that happened to me, when I was child, I started to be good at school and I started enjoying science. Then my friends, some older ones who used to go church every day, started thinking like, he's kind of something. Then I said, okay, if faith is that, then I'm out of this thing. So from my grade seven, I think I can say 7 to 10th grade, I was leaning toward this being atheist because I like science and I thought faith is against science. So I wanted to choose science. But later I came to understand that science is exploring, as you rightly said, it's just exploring what is there. So, and someone like a physician, I don't think there is even a place to doubt about it. How complicated the anatomy, how the physiology of like blood things. After understanding those things, how can you say this came out of nothing? Or so there should be an intelligent being behind this, and that should be God. So we are exploring, and I believe God is letting our mind to understand what He has done there. And whenever, like surgery, you know, it's very much helpful, and God wants people to be benefited from. So I like there's one guy who says I have no enough faith to be atheist. Being atheist requires more faith, much more faith than being.
In yourself,
Yeah,
in what you, or in only what you see in yourself. You have to have so much faith to
so much
deny
faith to
the
be.
existence of God. I love
Yeah.
it. That is so true. And that's exactly what I always say. I always say, if you know the human body
Hmm.
and you still deny God, there's some sort of
Something wrong.
disconnect, because it's
Terribly wrong.
impossible. The way everything is synchronized, how it's placed, the fact that we have spare parts, like
Hmm.
I don't know in general surgery how it is, but and in GI, but I think it's the same thing
Yes.
because you
Yes.
guys do like transposition, like
Yeah.
yeah, I don't want to mess it up, but whatever you guys do. Like for us, we do tendon transfers, bone
Hmm.
transfers. These are spare parts. These are, God has created us with extra stuff in
Yeah.
case
Yeah.
our body needs it. And you're like, okay, you're telling me this is
Hmm.
done by somebody that,
Exactly.
no. So anyway, yeah.
That's
So I,
another.
but I love you pointed that like those two parts have kind of pushed each other away, but it is impossible to do one without the other.
Hmm.
Like you said, God has given us this mind and brain that can create, which is
True.
because we're created in His image, so we're
True.
able to create somehow, right? He has given us that power. So to discover and create things that are beneficial to other human beings,
True.
in service to other human beings. Unfortunately, well, we've used that brain to actually destroy other human beings as well. So
Yeah.
there's that.
But there's nothing you can do.
Yeah. So I love that. So I mean, it's been a fantastic conversation. So I just want to end it with maybe two things.
Mhm.
One, I'm so excited for the MIS Africa project because I'm always pro teaching. And I
Thank you.
really do believe as a teacher, if you do not produce students that are way better than you, then you have failed as a teacher.
True.
And I think you're a great example for that. So what do you have any projects in mind? What's in the works for MIS, and how do people get involved, whether as teachers, from anywhere in the world or any other part of Africa that want to be involved in your project, or to come and train in one of your training sessions? So tell us more.
Yeah, I think that's very important thing. So, if you, I think in any training, nowadays, you have to have the skill before you go to room to the actual patient. So it all starts with a simulator based training. There are dry labs with commercial simulator box where now we are giving our training. Then there is a weight lab where people get their training on live animal models like pig and others. Then they move into actual patient. But since we don't have those structured training, be it dry lab or weight lab or whatsoever in Africa, that's one of the reasons why we have remained behind. So what we do differently, there are many programs where they give these simulator based 2 days 3 days workshop. Then they certify them and then they go, so people keep that certificate and never move into the practice. So in what we do differently in MIS Africa is we give simulator based workshops and we give follow up hands on training on their respective hospitals for now. So far we have given 100 plus surgeons simulator based training in 6 sessions, and more than 20 surgeons hands-on follow-up training. Now we have like 5 surgeons started doing basic laparoscopic surgery independently. So we really believe that follow-up hands-on training in real case is very important to uh, transfer the knowledge, skill, and make them start the career by themselves. So that's where MIS Africa is acting differently. But we still believe that those steps are very important. We are doing this because we should not be waiting for everything in place to begin with. But we are doing with what we can, and we are working on developing the standard laboratories. So in that case, as I tried to mention earlier, one of our colleague in MIS Africa is working for a grant for a weight lab from Germany. He has now reached the last phase. He's going to join them on Zoom. They will have meeting to decide whether to offer that grant or not. So we are doing everything possible, collaborating with people from different parts of the world, and we believe that we will have this weight lab, animal lab, like not far. So that's what we are heading, and we have collaboration with MedSurg support from France. They are very much keen on teaching this or introducing laparoscopic practice at different parts of Africa. So, for your information, our first move out of Ethiopia is to Burundi. Our team visited Burundi, one hospital last month, and
Nice.
yeah, they have a preliminary agreement has been made. So the move is with our collaborators to equip. That's the hospital with no even laparoscopic tower, but they have very good interest, very good infrastructure. So those team from France are going to equip that hospital in Burundi. Then the next move will be having simulator-based training and hands-on training there, and definitely introducing laparoscopic procedures to that hospital. And the next move will be Tanzania. Unfortunately, during that time, there was some issue in Tanzania following election, so I couldn't visit that. But there is a hospital in Tanzania where we are already having communications. And other thing is to bring surgeons from those countries to our centers where there is a large volume of case, and to have really good exposure and bridging. So going with them, one of our surgeon might go with them and help them to start. Then it will move like that. So the name was not just randomly picked. We said there were other names with Ethiopia in it, but we selected Africa because we knew that we will be the biggest or important institution regarding this area. So MIS Africa, as its name implies, will be actively involved in any activities regarding laparoscopy in Africa. So I think apart from training and transferring skill knowledge, starting programs here and there, I think that's by itself a lot because as I just mentioned, cross speciality is there, and so the only thing we add on that is equipping also. Whenever we have a good collaborators willing to equip, like in Ethiopia, we have equipped two hospitals with complete tower, with in collaboration with med-surg support, and many hospitals with tower but missing some small parts like insufflator or something. Then we have supported many hospitals like Adama Hospital, Yekatit Hospital, Neckend Hospital. Now there is one insufflator is coming for Armed Forces Hospital. Now. So that's part of it. And the training also, we are not only training surgeons, but we are training nurses because we believe in team. And the coming 2 days, Monday and Tuesday, December uh, 8 and 9, I think, there will be training for biomedical engineers because we saw that every hospital store there is like I cannot say every, but many hospitals that we tried to look into the stores, as you know, there is laparoscopic tower. So and the very simple and minor issues are holding back from doing so we are going to give training to biomedical engineers from 16 hospitals, I think, throughout the country, and the trainers will arrive tomorrow from France. So that is going to happen. So I think it's a lot. Yeah, we're focusing on training, but not only to surgeons or gynecologists, but every single team member. And we are also planning to have one for anesthesia also. So equipping, training, and helping to start in their own centers. We don't just train and give them certificate and let them go. So that's how MIS Africa envisions to move.
Exciting stuff. I'm so proud of you. I'm just overjoyed
Thank
for
you.
for this thing that you're doing, and I obviously can see that there's a blessing on it, so keep going. Keep doing the good work, and I love that you're making it a team approach. That's the one area I think we have greatly failed in our country in Ethiopia, is because the surgeons are continuously advancing in training and the
Mm-hmm.
rest of the team is just left behind. And that's you're I because you've been in the system long enough, and
Mm-hmm.
obviously you are an observant, you observe a lot, you have identified exactly where the issues lie. So I'm so excited to see the obviously successful outcomes of the programs that you have. So lastly, what advice do you have? And especially, this is controversial, but we recently had the TikTok award or whatever. Seeing that and knowing our young generation is what they're being exposed to and what's being celebrated. Um, and from your journey through life and what you're doing right now and everything, what would you advise a young person, somebody who's like 16, 15, going through high school? What would you advise them?
It's difficult, you know. TikTok is the one of the social medias. I have no idea how it works. You know, I have some times where a friend sent to me a TikTok video. Then I opened it, downloading the application. Then I didn't know how it works. Every just coming and going, so I deleted it, and I had to, you know. So I'm
So
not
funny.
really aware of what's happening in that world. Even in Ethiopia, I think recently there are controversial things happen, and people are just saying a lot of things. So I don't know. It's really difficult. But what I would advise is having time to listen to themselves. Everybody created by God. has come to this world with something in each one of them. So, and that thing is very important, not only for themselves, but it's actually not that important for themselves. It's really important for someone else. So it has to come out. You don't have, so they should not be just aiming to copy what others are doing. There might be some good stuff there also. There might be people for whom TikTok became, right platform to release what is in them. There might be a right way of using it. But what I want to say is there should be a time to listen to themselves, know their potentials, and work on that, and invest on themselves in, like, be it spiritual or growing in knowledge and having good people around them, and trying to do what would make them better people. Like, they should not be tempted with what's happening around. Shortcuts are the most difficult things, the bad challenges, difficult challenges, you can't always win them. There are the war continues in life, but battles come now and again. After you win one battle, another will be coming. You can but the difficult ones are when there is a shortcut to what you think it will take time, like being famous or having some money. The shortcuts are not good. It's like fast food. So I want them to invest in themselves, build themselves, and help to come out what's in them. So I think there are times that I was tempted. There are, like, as you can clearly imagine, there are financial struggles, things like that, and there are so many very easy ways to make money, abandoning what you are called to do, but fighting, resisting that, and moving forward and become a person who have something to deliver to this world. If, as we have said, time is short, enjoy the day and live for a purpose. So, for people who have enrolled in medical world, I think it is changing a lot. It's changing very fast. Something you have calculated when you started your residency is no more there when you finish. It's like, not taking like years. Things are changing. So the judgment or making decisions should not be based on what is happening today or what's happening around. So they should believe what God has put in them. They should put their trust in God, and work hard. And I think there is enough space and enough project no one has touched. And I think everyone is created with a solution for existing problem, and we have endless problems, especially in our part of the world. And take that as an opportunity, come up with solution, and sell it to the bigger community. Enjoy life. That's what I would say.
Love that. Thank you so much, Effie. It's been great. It's been real. I love it, and I'm so proud of you. And I hope to see you do more. I hope to see your project flourish, expand even beyond Africa. Um, yeah, and I hope to have you back here and we talk about the progress of what you're doing.
Thank you very much. It's a really privilege. I didn't know that I could speak this long, but I believe something important has been said. And thank you very much having it. I am very much sure that I will come back, and I want to say also thank you, and just keep on moving. I think this is a big thing, and things will take shape, and you will be one of the most viewed, uh, what you call show or whatever. And I'm sure you started something big in a professional way,